Good morning, ma'am. I am Daisy Jane D. Arsad from the SN2C. Now I'm going to perform the bag technique. So, bag technique is, you know that the bag technique is one of those essential tools that you need to perform, you need to consider when you performing or doing home visitation to your clients. So when we speak of bag technique, it is a tools which a nurse perform, usually the health-related procedures, and this technique, it was able to save time and efforts. So this is effective nursing care to her clients during her visits. So when we speak a public health bag, this is to consider as your indispensable equipment of any healthcare provider, which she or he has to carry along with her home visits. So what is the purpose of this bag? So bag technique is essentially minimize, if not totally prevent, the spread of infection from individual to families and ultimately to the community, while rendering effective nursing care to the client and or family members during home visit. So we have to consider also what are the different principles when we use the bag technique. The use of the bag technique should minimize, if not totally prevent, the spread of infection from individual, families, and hence to the whole community. So it is also has to consider that it saves time and effort on the part of the midwives or nurse. So if any healthcare provider during the performance of the her procedure. Bag technique should not also overshadow concern to the patient. Rather, show effectiveness of the total care given to the individual or to the family. So the moment that the family would be able to see you're bringing your bag, it has to give that the idea that you are effectiveness nursing care, rather to give them a sense of apprehension and anxiety or what you're supposed to be to perform with them. And lastly, you have to consider that this bag will perform in a variety of ways and depending upon agency policies, actual home situation, as long as the principle of avoiding transfer of infection is carried out. So when we use the bag technique, we need also to consider the important points in the use of this bag technique. The bag should contain all necessary articles, supplies, and equipment that will be used to the answer emergency needs. So the content of this bag is considered clean and sterile, while the contents, the one that is contact with your patient, is considered dirty and unclean. So the arrangement of the bag or the contents of the bag should be the one most convenient for the user. This is to facilitate and avoid confusion. But basically, there's institutional variation for the content and placement. There's institutional variation for the content and placement of the bag. It has also be accessible and convenient to the user or to the one may use this one as to avoid confusion. So you also have to remember another important points is that hand washing is done frequently the situation. So basically we do hand washing at the start of the procedure and at the end of the procedure. So but in between, if there is need for you to conduct hand washing, and you have to do hand washing. So the bag use is done for a communicable base. They thoroughly cleanse and disinfected before keeping and using it. So what are the contents of the bag? I need to open this one so we would be able to see the whole contents of the bag. So you now sometimes fascinating that this bag would be containing all those necessary materials to take care of your clients. It contains all those necessary supplies you will be having with your soap and a soap case. And if you don't have a soap bar, you can apply your liquid soap and place that also hand towel that will be used for drying of your hand. So this is the soap and this. And after that, you need also your paper lining. This is to prevent the direct contact of bag to the surface of your patient or your client's table. And also plastic lining, which is used base is to keep the area from being contaminated. And also you need to wear your apron to protect your uniform from contamination. And you need kidney basin to keep your things organized. And also the cotton balls with alcohol. So we need the tissue. And then the alcohol, 70%. And then the medicine glass. The sterile gloves, the solution, the Benedict solution and the acetic acid, and then the alcohol lamp, and then the scissor. So we need this much. And then the 2 drops. And then the 2 syringe. Also the thermometer and the holder. And then the 2 test tube. So basically those different contents of the bag or supplies are placing is very small bag. So that's how magical this CHN bag. So let's go now for the placement of this replacing back together. So let's remember that the bag has different parts of we have to remember. We have here the front part. So we are here the front part. So the front part of the bag which contain your thermometer. It can be digital or whatever type of thermometer that you will be bringing. So and then you also considering the center of the bag and containing all those materials. And this one in here is considered as your bar portion and the rear portion of the bag. And this one will be your side, okay? Your side. And this would also with your considered as your top inner of the portion of the bag. And this one would be your top or pocket, but this is an old bag, so there is no pocket in there. We placing all necessary materials, so that should belong here in the pocket. So for the content of the bag, on the front side, from left to right, you have to place their proper sequence. Your thermometer includes your oral, rectal, or digital thermometer, your syringe and needles and metal container if possible. And then your left side, you have to place your medicine glass and weighing scale. So for the right portion of the bag, these are placement of test tube and holder. Medicine dropper, medicine glass, match, alcohol lamp, and denatured alcohol. So for the center of the bag, this is your placement for your hand towel inside your plastic bag, your soap inside the soap case, your cotton balls, baby scale, tape measure, sterile dressing, your 4x4 OS, your cotton balls, also cotton ball soap in isopropyl, um, cotton ball soap in a soap sub solution, cotton ball soap in sterile water, and your dry cotton balls. Also, here, your hypoallergenic plaster, two pair of sterile forceps, stereo cold clamp for pieces of disposable syringes with needles and kidney basin, hot water bag, and your ice bag, and your sterile cotton applicator, and you also have a hit in here with a sterile tank depressor, tape measure, and empty glass container. The top of the bag, this is the area for your extra paper for waste receptacles, and it can be your paper bag or extra plastic bag, your plastic lining and your paper lining, and two pairs of sterile gloves, and then your apron. So when you have the table that you do, you have lay the paper lining on the table. So the folded portion of the top at the table. For the purpose of that is to protect your bag from being contaminated. So after that one, you put the strap underneath the bag. As for the basin of water, if glass and water, if faucet, if not available, place in outside the working area, and even there is just nearby faucet, and you can just go there and wash your hand. So take out the hand towel, will take up with your hand towel. So you can also take your plastic lining, then you place.
Yes, ma'am. Can you give your understanding about of course, for how we eat on our family, how that is safe on us.
So we are now to perform your Benedict's test. When we performing the Benedict test, you have to ready for all those materials. We'll be using with your pipette. So in case there's no pipette, you can use your 5 ml syringe, and then after that, you also been living with your test tube thing. Then after that, you also be needing your alcohol lamp. And then, so you place everything in your working area. And you have to explain the procedure to the mother. Good morning po, ma'am. I am Daisy J.D. Arsad. I am your nurse now. Now, ma'am, I am going to assess you for this assessment today. So, the Benedict test is to check for the presence of sugar or glucose in your urine. So, usually po, nagkakaroon po ng glucose or sugar sa urine kung kapag may problema ang isang tao. Lalo na kung may diabetes, so minsan makikita natin ito sa nagbubuntis, at malalaman natin kung ang presence ng sugar niya ay kung gaano na po karami po ng sugar niya sa kanyang ihi. Kapag marami na po ang ito is kailangan na natin i-assess sa health center for further diagnostic. So, okay po, ma'am? Okay. So, when you have to start, what do? Open your Benedict solution and your pipette. You get 5 ml. After that one, you pour it over your test tube. When you pour it, make sure it is on top of your waist receptacles. so that as to avoid spillage, or if there would be some spillage, will not contaminating your working area. And after that one, you place it your medicine glass. And then after that, you ready your urine. You ask already ahead of time of urine sample from my patient. So before we start to the procedure, you have to wear your gloves, so you do your gloving. And after that one, you need over your flame. You have to be careful when you get your flame. Make sure all your materials and supplies should be away from your alcohol lamp. Be sure no one is smoking, or no one can cause possible of fire in the area of the patient. So approximately like 30 seconds. So while you're heating, it makes sure that you are interacting also with your patient or with the mother, So to avoid causing so much anxiety. And her part, so as you can see, the solution when is attempting to boil, just you see some moisture precipitating on the test tube, then it's time to remove. And then after that, when you have to add urine. So how many urine drop you have add? 1 to 2, 5 of drops of urine. So you need to drop 1, 2, 3, 4, 5. So after boiling, let it cool. Let it cool. Then after that, while waiting, so you can now ready proceed with your acetic acid. Associate time and effort. So when we do your acetic test, acetic acid test, you have to remember also your acetic acid test to take out all those necessary materials. So for your acetic test, you will be needing your test tube, and also will be needing your 5% acetic acid, your syringe for your urine, and syringes later on acetic acid. So what do you do? Let's start with the procedure should be explained to the mother. Good morning po, ma'am. I am Daisy Jane D. Arsad. I am your nurse now. So now, we're going to assess you for this assessment po, ma'am. Ma'am, itong acetic acid test po ay isang test po natin para i-check po ang iyong ihi. Ito ay presence po ng albumin or protein. Usually po, wala po makikita ng albumin or protein sa iyong ihi. So, malalaman natin po ito kung may presence ng carbonate or phosphate at kung may presence ng albumin. So, kapag may presence ng albumin or kailangan natin i-refer sa health center or check up for diagnosis to prescribe the necessary treatment. So, you go with your first procedure. What do you do? When your first procedure, you fill the test 3/4 or 4 of urine, gently hit the upper portion to boil. And to boil approximately 1 to 2 minutes. So, what do you do after that one? And so we have to be careful with the using your test tube holder. So you only have to hit the upper portion approximately 1 to 2 minutes until it boils.
Samok yung banginangan.
Pagkatapos mag-boil, lagyan na naman ng 1 drop ng acetic acid. Then, bukala na naman. Same din sa susunod na process, parang 3 times nalagay ng acetic acid. Then, lagyan na naman ng 1 drop ng acetic acid. So, last, so I see the result. It remains blue. So it means negative. And this one, there's no cloudness and negative as well. So after that, clean all those materials and put some alcohol for disinfected materials. materials are all clean, we will now ready to return this material to the OB bag.
Yes, ma'am.
So, ma'am, ang result ng iyong test, sa Benedict test is negative result. So, ibig sabihin, wala po kayong glucose na nakita sa iyong ihi. As well as acetic acid, negative rin po. It means wala po albumin na nakita sa iyong ihi. So, next week po, babalik po ako para mag-test po tayo ulit. Para ba sure kung negative pa rin po ang iyong resulta. So, thank you po, ma'am. That's all for the OB bag assessment.